It's Breast Cancer Awareness Month, and today we are joined by Melissa Yabrough with Hendrick Health to talk a little bit more about early detection, testing, why that's all important. So good morning, and thank you so much for being here with us today.
Thank you for having me.
So we'll get right into it and talk about mammograms. Can you tell me what they are and what they're for?
So mammogram is still the gold standard for early breast cancer detection. You have those, a screening mammogram starting at age 40. There is a lot of fear and just people don't want to have it done, but it's a very necessary test. We have very trained technologists that take good care of our patients. Like I said, it is the gold standard still for early detection of breast cancer and is very important in the treatment as well.
And you touched up a little bit about how it's something that can be very scary for many people. So what can somebody expect when going into this type of testing?
So you'll meet your technologist. They try to make you feel as comfortable as possible. If you've never had a mammogram, they explain all of the steps of the mammogram to you. It is, there is compression. That's what everyone is concerned about, that it's going to be painful. It is a test that is uncomfortable, but we try to make it as comfortable as we can for the patient because it is so necessary. And we try to encourage the patient to relax and just it'll be over, it's a quick exam, but it's obviously a necessary exam. So.
Yeah. And so when should this testing begin for people in general versus a person who might have already history of breast cancer in their family?
Okay, so for the general population, we say start screening mammograms every year at 40. If you have a first-degree relative, which means your mom or a daughter or another relative, say if it's your mom, if your mom had cancer at 40, the guidelines usually say to start 10 years before that. Mm-hmm. It just depends on the relative. There are other genetic testing that we're doing as well at Hendrick that can kind of give patients an idea if they have any of those genetic markers for breast cancer and other cancers as well. But that's the general rule of thumb.
Mm-hmm. And this, again, like you had mentioned, this is a pretty scary process. So for anybody who's watching at home that, this is something that they've been contemplating, but fear is just one of those factors that keeps them from taking this first step into getting tested, what would be your message to them?
Just realize that it is something that we all need to do. Whenever breast cancer is caught in its earliest stages, the 5-year survival rate is 99%. So getting those early testing things done, getting your clinical breast exams, the mammograms, all of those things, it is uncomfortable. It's not something that we want to do, but it's something that's very necessary. It's very quick. Just talk to one of us when you come in, explain your concerns, explain your fears, and we'll do our very best to comfort you but to get a good exam and get the best quality care that you can get.
Perfect. And so that's kind of all the questions that I have for you. So I do want to thank you so much for educating us a little bit more about early testing, early detection, and a little bit about mammograms. So thank you so much.
Thanks for having us.
And we will be right back, but first we'll take a look at what's coming up on Good Morning America.